Well, it's a common scenario. Your arm or leg begins to go numb, or suddenly it's hard to pronounce simple words.
Now, many Americans miss the warning signs of a stroke, and without fast treatment, they can be left with permanent damage. But as Health Watch reporter Beth Galvin explains now, an experimental laser treatment has given a Gwinnett County man a second chance.
Lisa and Russ, Donald Parks had just undergone a hernia operation when he says he went home and went to bed for the night. The next day, he couldn't get up, and by the time he realized he was having a stroke, there was only one option left, an experimental treatment he now believes saved his life.
I was trying to stand up, and I just kept leaning, and I couldn't stop leaning.
Hold your arm straight out like this.
Donald Parks is thrilled to be able to do little things like lift his arms after waking up November 5th in the middle of a nightmare.
Stick out your tongue.
A stroke.
Good.
I couldn't stand up. Fell over. My wife tried to hold me up. She couldn't hold me.
These white spots are areas of lack of oxygen. This is areas of damaged brain, and this is his stroke.
A blood clot had cut off blood flow to part of Donald's brain, and the 72-year-old, never one to sit still, suddenly couldn't move his left side.
I couldn't stand up. I couldn't catch myself with this arm. So it's scary.
Even scarier, because Parks had been sleeping, no one knew how long he'd been having a stroke.
He still had movement of his arm and leg, but it was very severely impaired. And then touch my finger.
Dr. Marshall Nash, director of the Neurosciences Unit at Gwinnett Medical Center, thinks that Parks was probably 7 to 8 hours into his stroke. The problem? TPA, the only FDA-approved drug to stop a stroke, has to be used in the first 4 hours of the attack. But Dr. Nash says most stroke survivors don't realize what's happening to them in time.
So if you're sitting here watching this program and your hand goes numb, you're going to think that your hand fell asleep. You're not going to say, oh, I'm having a stroke, I better go to the emergency room. And unfortunately, it may take 2 or 3 hours before your arm goes out, and you know that you've had a stroke before you're going to call 911.
And by the time Donald Parks was transferred to Gwinnett Medical, he had only one treatment option left.
And they didn't know whether it'd do any good or not.
This is the phototherapy cap, and this just basically provides a guide of how we're going to put the laser light distributed through his brain.
An experimental, somewhat strange-looking laser treatment.
And this is the front there. So we actually remove site 1.
Instead of drugs.
It's kind of like, hey, they're using scientific stuff on me.
Dr. Nash shines a laser light through the skull and into the stroke-injured brain, delivering infrared energy into the tissue to try to stimulate the damaged cells.
We treat the whole brain, not just the part of the brain that had the stroke. We can keep cells alive, potentially. It's a study, so you have to understand that. We keep cells alive long enough for your body's own recovery mechanisms to kick in.
Dr. Nash says if this laser proves effective, it will buy stroke victims like Donald critical time, giving them not just 4 hours to get help, but 24 hours.
I didn't expect to move for a long time.
Because this is a study, Donald Parks doesn't know if he got the laser treatment or a placebo, but he says within hours he started regaining the use of his left arm and left leg.
I got some of my movement back.
That's good.
And I don't know how to explain it. I guess your brain rebuilds itself, but it's got to be stimulated to help it out.
Donald Parks says he's not sure how a laser can stop a stroke, but he's sure a believer.
And how do you feel now?
Great. I feel great. Wonderful. Glad to be alive.
Gwinnett Medical Center is one of only 2 hospitals in the Southeast offering the phototherapy treatment through this study. It is completely voluntary, but it gives stroke patients who are running out of time the only real chance at a recovery. Russ and Lisa?
Good to hear him laugh. Thanks.